A baby has started to get his first milk teeth. His age is approximately A. 3 months, B. 6 months, C. 9 months, and D. 12 months. Now let me explain it. Now the most babies have their first primary milk teeth erupt at the age of 6 months, and the first secondary teeth erupt at the age of 6 years. The teeth in the upper jaw erupt earlier than those in the lower jaw. The teeth in the upper jaw erupt earlier than those in lower jaw, except for the lower central incisors. The lower central incisors appear commonly between the ages 5 and 8 years. Now coming to the correct option here is The correct option here is six months. Which of the following statement is true for physiological jaundice in neonate? A. Occurs in first 6 hours of delivery. B. Neurological sequelae are common. C. Best treated by phototherapy. D. Starts on second day of life. Now, about neonatal jaundice, I will tell some important points. Most neonates develop visible jaundice due to elevation of unconjugated bilirubin concentration during the first week. This common condition is called physiological jaundice. It lasts for 5 days in term infants and 7 days in preterm infants. It does not require any treatment and it disappears spontaneously. Whereas in pathological jaundice, the clinical jaundice will appear in first 24 hours of life. So from this discussion, what do you think is the correct option here? The correct option here is D, starts on second day of life. Because if it occurs in first 6 hours, it is pathological jaundice. Neurological sequelae are common in pathological jaundice. And physiological jaundice does not require any treatment. Which of the following agents is most commonly associated with recurrent meningitis due to CSF leaks? A. Meningococci. B. Pneumococci. C. Haemophilus influenzae. D. E. coli. So, most commonly associated with recurrent meningitis. Now, intracranial CSF leaks usually causes bacterial meningitis and 80% are caused by Streptococcus pneumoniae. Other causative organisms are Meningococcus, Haemophilus species and Staph aureus. So the correct option here is pneumococci. Child draws a triangle at what age? This question is commonly asked in the NEET PG exam, FMGE exam and the INACT exam. A. 3 years. B. 5 years. C. 6 years. D. 7 years. Now listen to me carefully. In 12 to 24 months, the baby tries to scribble spontaneously. At 2 years, the baby draws a vertical or horizontal line. At 3 years, the baby draws a circle. At 4 years, the baby draws a cross or plus sign and rectangle. And at 5 years, the baby draws the triangle. So, what do you think the correct option here is? The child draws triangle at what age? A. 3 years, B. 5 years, C. 6 years, D. 7 years. The correct option here is B, that is 5 years. upper segment to lower segment ratio in a 3-year-old child is A 12, B 1.3, C 1.4, D 1.6. Now listen to me carefully. At birth, the upper segment lower segment ratio is 1.7:1. At 3 years, it is 1.3:1. At 7 years, it is 1:1. So what do you think is the correct answer here? Upper segment to lower segment ratio in a 3-year-old child is 1.3. You can click the link in the description to join the NEET PG Masterclass, which is the ultimate masterclass. It will be a 6-day masterclass from June 24 onwards to June 30. It will be very beneficial for fast revision as well as preparing a blueprint for the PG entrance exam. It is definitely a game changer class. Drugs used in ADHD are A. atomoxetine, B. methylphenidate, C. dextroamphetamine, and D. all. Now, the common stimulants used to treat ADHD include amphetamine, methylphenidate, dexamethylphenidate, methylphenidate, then dextroamphetamine. So these are the different drugs which are used in the treatment of ADHD, attention deficit hyperactivity disorder, a very commonly repeated asked topic in all the PG entrance examinations, including INICET and NEET PG. So what do you think the correct option here is? Correct option here is all. Atomoxetine, methylphenidate, dextroamphetamine, all. So correct answer is D. You can WhatsApp me on 9483652020 for any doubts, or while you are preparing, any difficulties you are facing, or any difficulty in any of the 19 subjects. I will be happy to help you. What is THELARGE? A. Pubertal breast enlargement in boys. B. Breast enlargement in pregnancy. C. Hormone-related breast enlargement in girls. D. Post-hormonal therapy breast enlargement in postmenopausal. So, the definition of THELARGE is beginning of secondary breast development at the onset of puberty in girl. So, the correct option here is C. Hormone-related breast enlargement in girls. Selenium deficiency is seen in, this is question which is most often repeated. A. Cashion's disease. B. 5-HT4 agonist. C. Macrolides. D. Dimethylmethane. So, selenium deficiency is seen in Cashion's disease. Causes of conjugated hyperbilirubinemia is A. Rotor syndrome. In a child, foreign body in lung, what to do? A. Rigid bronchoscopy. B. Chest X-ray. C. Flexible bronchoscopy. D. Direct laryngoscopy. For removal of foreign body in lung, the treatment of choice is rigid bronchoscopy with appropriate antibiotics. So, what do you think the correct answer here is? The correct answer here is A. Rigid bronchoscopy.